Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So how many of you have a cough and have no idea what it's about? Well, some people do, and sometimes it's a cold, and sometimes it's not. I actually have a cousin who has a cough, and she has been to a lot of doctors, and whatever they've told her, she still has this cough. So we brought Gustavo Ferrer, who is the founder of of a cough center, and you're author of a Cough Cures, the Best Natural Remedies on Over-the-Counter Drugs for Acute and Chronic Cough. That's a big subject. So how did you start with this, Dr. Ferrer? What kind of a doctor are you?
That's right. I'm a pulmonologist. I'm a trained pulmonary doctor, lungs doctor. I trained in medicine and pulmonary medicine in Cuba, and then came to America and went for retraining. We have to redo that. So I went for retraining in internal medicine in Texas. And then I went to George Washington University in D.C., where I had my fellowship in pulmonary and critical care medicine. So I then joined the Cleveland Clinic for many years, and I'm currently the program director for pulmonary fellowship in Aventura Hospital.
Oh, yes, I'm very familiar with Aventura Hospital. Our magazine, which I don't know if you've seen. Have you seen Boomer Times yet? Yes, well, that goes down in the Miami Herald into that area. And I'm so glad that you're here with us today because, and I can understand now why you understand so much about cough cures and what it is. So as a pulmonologist, evidently you saw a lot of this, and probably other pulmonologists didn't really get as deep. It sounds like to me that this was your victory, where you want to go.
Well, I think it all comes together from my background and training. In Cuba, when we get trained in pulmonary medicine, everything begins in the tip of the nose. And to my surprise, when I came to America, before coming to America, I worked as a researcher for the United Nations University for a couple of years in South America. In most countries, pulmonary doctors take care of anything from the nose all the way into the lungs. So when I came to America, I was very surprised that in general, doctors are very much divided. So you have a specialist for the nose, for the mouth, for the throat, an allergist, a gastroenterologist, a pulmonologist. And when you looked into symptoms that are extremely common as cough, all these organs can be responsible for the reason for the cough, and yet nobody's taking responsibility for them. So it's not the first center that is created. Mayo Clinic, I actually went and spent some time with the Mayo Clinic founder of Mayo Clinic Cough Clinic. I went to other centers in the country. In London, there is a long-standing tradition of cough center. There is a very well-known European pulmonologist that founded a center in the 1980s and 90s. Basically, the premises is that patients come to us not with a diagnosis. They come to us with a symptom. And we are responsible to guide that and to build up and to find the diagnosis. I guess it is the way that we train people in America. We think first about the test and less about the patient.
So that's right. I have faulted doctors actually, for not listening. Just sit the patient down and say, okay, what's the problem? And tell us all about it and where it started, right? And then you can become the diagnostician after you listen. Sometimes they don't listen. So I'm glad that you have this as a primary way to deal with people. Well, let me ask you then. So not all coughs are pulmonary problems, I gather.
That's absolutely right. In fact, most of the chronic cough, the main origin is up here in the nose. And most of the chronic cough is a response to what we breathe daily, to the environment that you spend your time. In America, cough and rhinosinus problems are probably the number one reason after when we exclude, of course, the smoking-related cough, which is the top number one. But not only that, we still smoke, not only cigarettes, we smoke now the vapings, all the electronic cigarettes. You have these places with the hookahs. If you pile all this up into the exposure to the dryness that we get from the air conditioning, that we get from the airplanes, the pressurized cabins. Our nose and breathing centers are constantly readjusting to all these changes, and of course triggers chronic inflammation. And we know today that this is not only allergies related. It's an ongoing inflammation for the way we breathe and so on. But also allergens are playing tremendous role. It's true that global warming has more CO2 in the environment and is incredibly good. It is actually a fertilizer for pollination. So we get more pollens and we get longer seasons, and this is where we are today.
Now I want to go back to when you said that now you're from Cuba.
That's right.
And how long have you been in the United States?
17 years.
Okay. So now I read years ago that because Cuba didn't have money under Fidel, and they did a lot more natural things. Is that true?
It is absolutely true, and I think this is one of the reasons why I decided to write the book. And the reason comes in Cuba. I guess I believe it was Winston Churchill that he said once, when we don't have money, it's a great time to think. And so I think that's what happened with Cuba. I have a lot of things against the Cuban government, but I cannot deny the value of well-trained physicians that they have in the 70s and 80s, that they were able to create incredible programs that they're wonderful. Medicine is one of the few things that has no political barriers. We all get sick, whether you are from whatever place. So doctors are our ambassadors. And that's what we do. And when it comes to writing this book, I put those ideas there because I realize, when we tend to go to the doctor too quickly, and then the medicine and the doctors have become responsive too. So we give people stuff. And the evidence, the research evidence to back up the things that we have over the counter is not there. In fact, most organizations said, the American College of Chest Physicians, which is the largest pulmonary organization, the president had said multiple times that most of the over-the-counters for cough and respiratory problems have no evidence for their use. Research shows that they have no evidence. And we spent last year $7.7 billion on that.
Well, I'm listening to you and I'm thinking about something. I have been a radio talk show host for 25 years, and I do a lot of talking. I have never really had a cough or a problem, unless, of course, I had, a cold. What can I do now what should I be taking? Salt water? Should I be drinking lemon water? What should I do to continue this?
That's an excellent question, and I talk to people that spend their lives speaking everywhere. Today I will say that there are many things that we can do. Exercise, everybody knows, is good. In my book, we talk about breathing exercises, not only just what people have learned from the yogas, but we have, there is a principle of breathing called Buteyko, created by a Russian physician in the 1950s, that teaches how to control our breathing and probably minimize trauma to the windpipes. But I'm a proponent also, and the evidence is there, research is there to back it up, to use nasal saline or nasal saline combined with xylitol, which is a natural product, which is excellent.
What is that?
Xylitol is a natural product. Archaeological research evidence shows that in the past, historical data from microbiology shows that xylitol has been used by the human race for thousands of years.
You talk about Z-I-T, xylitol?
No, actually C.
Oh, okay.
No, it's actually X. I'm sorry,
yeah, X. That's
Y.
right, XY.
Mm-hmm.
We just had someone at
L-I-O.
it's interesting you should say they have a sweetener.
That's
and
exactly
they do
right.
Yes, and I have them. They gave me a bunch of these, and you like that.
That is exactly right. If we go back to the 1980s, xylitol researchers in Europe, they found that mouthwashes and gums and toothpaste created with xylitol dropped the amount of tooth decay close to nothing. I recently was in speaking conference with a Finland researcher who established that in Finland many years ago. They have one of the lowest tooth decay. But when they did the research, they found that people also have less ear infection. So in the late 1990s, a group of people in Utah put together some nasal spray, and they combined those with saline, and they are phenomenal. They decrease the amount of mucus, they protect the airway, and because we are exposed to all this dry air, we spend a lot of time indoor. Heat is up, so dryness, although the humidity is high, dryness is low because the air conditions suck it out. So using nasal spray to humidify your nasal passages are phenomenal because the dryness of the nasal passages all the way to the oropharyngeal area create inflammation of the oropharyngeal area, and you can be hoarse and you can have postnasal drip and cough. So doing that combined with breathing exercise, good diet, even the xylitol people, I have seen now that they have cough drops that you can use it. They are sugar-free, they are natural, and they're excellent to prevent that inflammation.
And I have to ask you a question. Are you one of their sponsors?
No, I'm not.
Now, this is interesting because, as I said, we just had a big expo, and they were one of our exhibitors, and they gave me a huge bag. Gum, nasal spray, everything. And I've got to put the two of you together because you are just saying everything that they told me, but I believe you. Now I believe what they said. That's fabulous.
The research is there. I actually was introduced to this product by my co-author, Burke Lennihan. She is a Harvard grad nurse, naturopath, and she was using those for many, many years she has her practice in Cambridge. And it was introduced to her by the Harvard Pharmacy School. So there is a lot of good evidence. We put the research to back up those claims. I just this weekend I went to the Aventura Mall, and they were selling their pastries and things that they have made with xylitol today. Right. So I was surprised to see that there.
This is fantastic. I'm so excited that you were here for more reasons, but this especially because now I'm going to be chewing a lot of their gum and doing the nasal spray. But what I want to do is help people get your book. So it's called Cough Cures, the Best Natural Remedies on Over-the-Counter Drugs for Acute and Chronic Cough. And will they go to your website, which they can go to Amazon.com and get it? They
can go to Amazon. They can go to Barnes & Noble and they'll link it through my website. Is in English and Spanish. We have a good group of Spanish people that they buy for their grandparents, and they can go to my website, Gustavo, Gustavo, last name is FERRER, MD.com.
That is just great. I'd love to see that book because we have, we do a lot of book reviews and everything. We can talk about that later. But so what about serious coughs? So and there are people who have serious coughs, and that's when I guess you find out that they're having lung cancer or other serious issues.
That's exactly right. Unfortunately, cough, because it's such a common symptom, as an acute phenomenon, people tend to ignore it or just live with it, and then months and years pass, and they've been coughing for many, many years. Although we know that the great majority are due to the things that we spoke, the postnasal drip, they are due to acid reflux. Heartburn is one of the most common reasons as well. Smoking, but cough that lasts more than 3 weeks should be pay attention to, and they should go to a doctor that understands it, because it could be chronic bronchitis, it could be a scar tissue in the lungs. For some reason, we see more scar tissue in the lungs today than ever, and probably could be due to the things that we inhale and breathe. But also could be lung cancer, and that could be the first symptom that we see. Unfortunately, many people with lung cancer are diagnosed too late today, and well could be because we ignore these heralds, these symptoms that they are telling us that something is not right. So is
that the symptom, the cough? Is that really?
It's a very common shortness of breath as well, but cough it tend to be one of the most common symptoms. So we usually advise our patients and we put that in the book, 3 weeks cough. Don't assume that this is just a common transient thing. Yes, there are acute reasons for cough that can last more than 3 weeks, but don't make that conclusion by yourself. Have a professional see you and so on. And by the same token, we teach in the book to be conscious of, recognizing simple cough that you can actually treat at home and help yourself and help the system.
So, Dr. Ferrer, you are down in Aventura. Do you have an office there that people can come and see you as a pulmonologist?
That's right. That's right.
I don't have that phone number that I know. Do I have a phone number?
Yes, we have a.
Let's give a phone number out for that.
We have a phone number that they can call. At my office, we have an office in the Aventura area, and the number is 954-482-4747. 954-482-4747.
That's good. So I'm very impressed with this, because someone had asked me about a pulmonologist a few months ago, and it's funny. I do a lot of interviews. I do a lot of the Cleveland Clinic doctors. I do a lot of doctors all over, and I didn't really have a pulmonologist. Although I will tell you this, I think he's a pulmonologist. He's not new, but the vice president for Broward Health he's not doing that now, but I believe he's a pulmonologist, but he now got into the corporate world. And so, that happens. But it's also very important that people, when they're children, I notice a lot of children cough, and they cough. And I just want to go up to them, because it's pretty hard, and that you can hear the phlegm and you can hear the rasping. Is that because it's passed from one child to another in school? And what do you do? Just give them antibiotics? That's a very, very good question. The answer is no antibiotics. I'm actually, and this is something that I want to stress very, very much. We are facing a tremendous crisis in our country today. The antibiotics, the bacteria have grown resistant to most of the antibiotics that we use. And we're running out of ammunition to tackle serious bacterial infection. And one of the most common reasons is the abuse of antibiotics. And one of the most common reasons for abusing antibiotics is precisely acute respiratory problems. And the reason is that all these infections are virals. Viral infections, and the viruses will never be killed by antibacteria. So we tend to go to urgent cares and we get a prescription for antibiotics. And research shows the World Health Organization, all organizations in the country, last year, President Obama put together a coalition to tackle this issue. 7 out of 10 times, antibiotics are prescribed in either primary care or urgent care in America. It is absolutely wrong. It is not right, because they don't tackle the disease process. It's viral. No antiviral should be given other than Tamiflu when people really have the flu being diagnosed. So in my book, we go into explaining people the difference between the two and what are the things that parents can do for their children, and how they can actually do preventive things that can prevent all these issues, how they can use, what are the products and the ways to get the mucus out for toddlers and so on, what are the ones that have some research and great reviews. We have no affiliation with them. We just put it in there as a guidance. I launched my clinic, and about 6 years ago, I started getting those questions from patients, and everywhere I go, which thing works and not. And that's one of the origins for my book. It's actually my wife. She was one of those that was asking me, does this work? Does this not? So we did all the research for them, and it's laid out in the book. Oh, great. Well, we have to get that book. I want to see that, because these are questions. I have triplet grandchildren who are 11, and it seems like every time they go to school, they wind up with something. And yet one of them doesn't seem to be affected, where the other two are, which is interesting, because it must be the makeup inside. That's exactly right. Is that we all respond different to environment, and you're going to find this different type of genetic makeup in the responses. But the great majority of kids, they go to daycares or school and so on, they don't wash their hands, and that will never happen for those kids. But they pass those infectious process to one to another. There is always things that we can do. We have ideas in the book that parents can do to minimize that. Perhaps, pacifiers are things that we shouldn't use for a long period of time. They carry a lot of stuff, and it's a great way to pass infectious process and so on. The ways that we teach our kids to blow their nose and so on, I have some ideas in there. There's research to back that up. We tend to blow our nose into our hands. Kids do that a lot.
and they don't wash their hands, so they pass virus to each other.
Oh, my goodness.
So, it's a way to teach the kids to blow their nose into their elbows. And so there are a few things that can be done that research shows that drop it tremendously. And when we travel, when we go to places, when they're old enough to teach them how to gargle, there's research showing there's a study done in Japan that when you fly more than 3 hours, you increase the transmission of, or nasal infections and flu, and almost everybody that flies after 3 hours land and they feel their mouth is dried. So they did a study that every hour or so during the 3 hours flight, they gargle versus doing nothing. And the gargle people have 40% less viral infections transmissions and less problems. So we usually recommend that they do those gargles, and they do it during the period that they are developing the symptoms. We have herbs and teas that they have evidence for the use in the book that can be used during the gargle time. There's nothing extraordinary about them, but they have strong evidence for the use. And many things that have been used in different cultures for hundreds and hundreds of years, they do have evidence that they work.
I love this book, and I haven't even read it yet. You said something at the beginning about breathing exercises.
That's right.
Now, can you describe any of it? I know you
absolutely
tried it on the radio.
Absolutely. One of the things that we teach through the Buteco is called the Easy Breathe, and the reason is in the last 100 years we spent a lot of times sitting down, and you are standing up, and that's fantastic. But the great majority of people spend a lot of time sitting down, so the bases of the lungs are compressed, and we tend to hypo, meaning less ventilation. We tend to drop our breathing.
See, I sit at my computer a lot, so that's right. What you're saying is good for me. That's why I want to stand here for now.
So the natural way to do so is through the nose. We should avoid at all time, even when doing an exercise, breathing through the mouth, because it was not created for that, and there are many research that we can talk in another time about that. Why not breathe through the mouth? Breathing through the nose in and out in a pace that you time the inspiration. It can be 3 seconds up, 3 seconds down, 3 seconds up, meaning you take a deep breath, counting 1, 2, 3, and then you blow slowly 1, 2, 3. That trains the muscle, the diaphragm down here, and train your brain to be conscious of breathing. So you can train the brain to breathe comfortable, and then you can add on little pauses or holding your breath for a few seconds in between, so that you retrain the diaphragm how to breathe. Many trumpets or blow instruments players, that's the way they do it, and it's very helpful.
So do you ever have a seminar? I can picture this. We ought to probably put together a seminar where we could get people and you could do some of this. This is very exciting stuff.
Absolutely.
Are you having fun?
I this is my life, and I enjoy it so much. Last year in December, I went to the Cleveland Clinic Wellness Conference, was one of the speakers, and in my second talk, it was all about respiratory wellness. We talk about environment, we talk about smoking, we talk about walking, we talk about where to walk and not to walk. And by the end of the talk, I was asked by the organizer, Mike Roizen from Cleveland Clinic.
Yes, I know him.
And,
he was on my show once.
He asked me to do a breathing exercise with the whole audience. We have over 600 people. And we have over 600 people, and it was extremely successful. We have people like to do things in real life.
Yeah. Well, that's I have never heard this. As much as I'm a gerontologist, and I've been doing a lot of work in health fields and all, but I have never heard about this. I mean, we know that yoga, and we know that they have breathing exercises, which I don't really do that. I mean, I don't smoke. I've never smoked and all, but I still, as I'm starting to age, I see that I need to do something more than I'm doing. So I'm really very anxious to understand what you're talking about.
Absolutely. And I can add one thing in there. There are a few breathing exercises that have been linked to the yogas that actually they're not good. Some of them, they can be damaging. I have patients that pass out holding too much. That the physician is people hold the breath for too long. Those kind of things can happen. So in the book, we go into the one that have evidence, the one that they are safe, and they're good for everybody. So the whole intention of educating the great majority of population is to do things that can everybody enjoy, not just a small group of people.
Well, I'm going to tell you to put on your calendar, I think it's November 4th. I invented about 6 years ago, but maybe 3 years ago, and we've had 2 a year. It's called the Cure Symposium. It's cutting-edge understanding, research, and education. And I've had 12 to 20 doctors in a day, and we bring people in. We bring scientists from all over South Florida. And I think you'd be a great speaker. So I'm going to get you to reserve the date. I'll tell you all about it. I think you'd be wonderful.
We'll do.
Yeah, I mean,
absolutely.
This is cutting edge stuff that I don't, as I said, I haven't heard, and I know people are going to love this.
Thank you.
Yeah, you're welcome. So, what is the most, when people come to you though, what is the most, are they referred by GPs or what are the people coming to you for generally?
I have a larger spectrum. I get people from all over the place, primarily referred by primary physician. I also get people discharged from the hospital. They come to us. I have a large population that follow me from my prior practice at the Cleveland Clinic, and I get a good chunk of international people. They come referred by other pulmonologists for this kind of issues. So it is a variety, but I would say, the way the insurance refer people primarily is through the primary physician.
I'll bet you do a lot of second opinions. I can tell right now.
I would say that 90% of what I do today in my practice, we are a teaching group. We are 3 pulmonologists, 3 fellows, but my practice primarily is kind of a second or third opinion.
Okay, well, let's give your phone number one more time before we stop the show.
All right, my phone number is 954-482-4747. 954-482-4747.
And it is Dr. Gustavo Ferrer, Ferrer. Thank you so much for being with us.
My pleasure. Thank you for having me.